All right, folks. Today we're going to explore the complex world of long-term opioid use and its unexpected effects on our bodies, especially when it comes to hormones. You might be wondering, why all the warnings about opioids? And what are these hidden impacts? Well, you're in the right place to find out. Hi, I'm Dr. Pierre, a board-certified anesthesiologist and addiction medicine specialist. With extensive experience in the operating room and in both methadone and Suboxone clinics, I've dedicated my career to helping patients overcome the challenges of addiction and recovery. I also specialize in hormone replacement therapy, working closely with individuals to restore balance and improve their overall well-being. While this podcast is designed to share valuable information, it's important to consult your doctor for personalized medical advice that fits your unique health needs. You may be wondering why an addiction doctor is interested in hormone problems. Well, I would have wondered that myself 25 years ago when I started my journey to become an anesthesiologist. However, after managing thousands of patients who were struggling with addiction, I learned that addressing the effects of drugs on the endocrine system was a missing link to helping patients thrive in recovery. So I've dedicated myself to providing a complete addiction treatment service to address the medical, psychological, nutritional, and hormonal aspect of recovery. By focusing on the whole person, not just the addiction itself, I aim to help my patients regain their balance, health, and quality of life. This comprehensive approach enables a deeper, more sustainable recovery, empowering them to rebuild their lives on a solid foundation. Let's start by understanding how opioids can quietly interfere with our hormone systems. Most of us think about the obvious risks, like addiction or overdose, but there's more beneath the surface. Opioids can disrupt your body's entire control system, affecting everything from energy levels to mood to bone strength. Imagine if your medication, which is supposed to help you, is actually causing these silent side effects. It's a lot to take in, right? To help us make sense of this, we've got two main sources. The first is a comprehensive medical research review titled Long-Term Opioids Linked to Hypogonadism. Yes, a mouthful, but don't worry, we'll break it down. The second source focuses specifically on women and is called Opioid Endocrinopathy in Women. Both reveal that this issue is not just about men and testosterone. It's about how opioids affect everyone differently. So how do our bodies normally manage hormones? Think of it like an orchestra. The HPG axis, which stands for hypothalamic-pituitary-gonadal, is the chain of command for your hormones. The hypothalamus acts as the conductor, sending out signals to the pituitary gland, which then instructs the gonads to produce hormones like testosterone. But opioids are like those concert goers who disrupt the flow, reducing signals and ultimately lowering testosterone levels. And this can happen shockingly fast, just hours after taking opioids. Testosterone is crucial not only for sex drive, but for muscle mass, bone health, mood regulation, and even heart health. And it's not just men who are affected. Women, too, can experience lower levels of estradiol, a hormone vital for their well-being. For some, this means fatigue, fragile bones, mood swings, and more. Hardly what you'd expect from medication meant to relieve pain. Switching gears to women's health, opioids can disrupt menstrual cycles. Research shows a staggering 70% of women using long-term intrathecal opioids, medication delivered directly into the spinal cord, experience amenorrhea, or absence of periods. What's surprising is that some of these women might still be ovulating, which underscores the profound impact opioids have on hormonal balance. But what can someone do if they suspect this might be happening to them? It starts with awareness and taking action. Simple lifestyle changes, like reducing stress, getting enough sleep, and maintaining a balanced diet, can help. And of course, communicating openly with your doctor is crucial. Sometimes, adjusting the opioid dosage or switching to a different type might be necessary. There are also non-opioid pain relief options to consider. For those with consistently low testosterone, testosterone therapy might be an option, although it's not for everyone. Hormone replacement therapy, involving estrogen and sometimes progesterone, is more commonly used for women dealing with hormonal imbalances. The key takeaway here is that opioids can have a widespread effect throughout your body, beyond just managing pain. Understanding these effects empowers you to advocate for your own health. If you're experiencing symptoms like fatigue, low mood, or changes in sexual function, talk to your doctor. A simple blood test can check hormone levels and provide valuable insights. The key to success is having open and honest conversations with your healthcare provider. Ask questions, share your concerns, and take an active role in your care. With the right guidance from a knowledgeable provider, it can also be a time of positive change and growth. If you choose to have that conversation with me, and you live in Oklahoma, Texas, South Carolina, or Florida, I'm here to support you directly with personalized care and expertise. If you're ready to take the next step, don't hesitate to reach out to me or my staff. Thanks for listening, and stay tuned as we continue exploring fascinating new topics together.